2019, the governor's child sex trafficking team, which does phenomenal work, identifies commercial sex exploitation identification tools, and worked with the Texas Department of Juvenile Justice and DFPS to establish training and protocols for its implementation. The screeners have already been deployed across the state for youth served by the juvenile justice system and the 5 largest counties for children in DPS and DFPS care. However, significant gaps remain. This bill seeks to expand the use of the screening tools to other geographical areas of the state and require the tools to be used more consistently. I have witnesses here that can speak to the gaps, the importance of screening, and the infrastructure in place when a child is identified, but I want to make a couple of things clear. This is a tool that is validated, was identified by the governor's child sex trafficking team, and is already being used in the state. This tool is not designed to be a structural interview with a child. This is a tool that agency staff fills out based upon their knowledge and observations of children they serve. If a child is identified as a clear concern for the risks of sex trafficking, there are care coordinating teams in place that covers 95% of the state to ensure children receive the support they need. This bill ensures we can identify children to serve them better. Madam Chairperson, I do have a committee substitute, and the substitute merely clarifies that the language in the bill, but DFPS implementation and ensures the agency uses the tools based on validation guidelines regarding the child's age or concern of sex trafficking. According to the DFPS, the substitute also eliminates the fiscal note, but it defers to the agencies on the questions about that. I would refer to them. I thank you, and if there are any questions, I would be happy to answer them and like to reserve the right to close, please.
Thank you, Dean Thompson. Members, any questions? Okay, we will start testimony.
Thank you.
Thank you. The chair calls, let's see. Yeah, we can start testimony. We're good. Let's see. Are we good? Those 3. The chair calls Rhonda Kirkendall, Caroline Roberts, and John Nehme. I'm sorry if I am not saying that right. Rhonda Kirkendall. Let's see. I have you as representing the Texas Human Trafficking Survivor Leader Council and self, and you are for the bill?
Yes,
ma'am.
Is that
correct? You may proceed.
Thank you. Madam Chair, committee members, thank you so much for the opportunity. I formerly worked at Texas CASA as our anti-child trafficking consultant, and there I wrote the CSE-IT guide that is used across Texas in the 75 CASA programs. As of May of 2021, I've also been trained to complete CSE-IT screenings. And so according to the DFPS Human Trafficking Response Protocols, this is a quick, it takes 5 to 7 minutes. It's an information integration tool. Those screeners will use intake processes, case files, their colleagues, Child Protective Services, juvenile probation, CASA volunteer or CASA staff, CSE advocates and caregivers to complete. There are 8 different areas or key indicators, and in those 8 key indicators, there are 46 questions that are asked. Of those 46 questions, 39 of them are considering 90 days previous to that screening. There are 7 questions that considers the entire lifetime of the child. And so as Dean Thompson was talking about, there could be a no concern, a possible concern, or a clear concern. Youth and children, they are not interviewed or asked questions, and this helps to make sure that there is no re-victimization as well. They use known data that are in their case files, and it is not meant to be a one-time assessment. We understand that as youth and children begin to trust the service providers, they may disclose more information. And so what we want is for this tool was created to be done multiple times. Allies Against Slavery, that does the Lighthouse database that houses a lot of the CSE-IT screenings, they have what is called a person identification record number, so that whenever you have multiple screenings, you can tie those to that same PIN number. This will not increase children being removed from their homes or increase children entering into the foster care system. We are looking at the population that are already in the child welfare system and juvenile justice systems as well. And the training for the CSE-IT screenings, as Dean Thompson mentioned, we are already doing screenings, or DFPS is doing screenings in the 5 largest counties. And so they have it laid out within their protocols. I can tell you within service providers and nonprofits, the Office of the Governor, the Child Sex Trafficking team, they have a training, and that training lasts for 6 hours, 1 day. TACFS, the Texas Alliance for Children and Family, they also have a training that takes about 4 hours, so it's a 1-day training as well. So once a youth has been identified as a clear concern, it triggers services with the governor's child sex trafficking team. And so Texas is divided into 5 regions. Each region has a regional advisor. And within each one of those regions, there are CSE advocate agencies. And that's what Dean Thompson was referring to when we're talking about Texas is covered by 95%. And so those agencies can serve youth up to 22 years of age. And the governor's office is also working on care coordination teams. You know, it is, according to the Texas model for care coordination, it is a collaborative, consensus-driven approach that is designed to identify, recover, and facilitate accessible, trauma-informed, holistic resources through this coordinated network of providers. We will no longer be working in silos, but talking to each other and working together. What happens with these kids, though, that score a possible concern? It's not a clear concern to trigger CSE advocate agencies. What we've seen across the state of Texas, though, are CSE advocate agencies are stepping in the gap, and they are creating programs to address these possible concerns. One of those is Unbound Now's EIP program, that is Early Intervention Program. They build rapport, determine goals, and help in this preventative space that we all need to work in. There is a resource for legislators to use. It's on the Texas CASA website, and it is the ACT Anti-Child Trafficking Program. There you can find resources to understand care coordination teams, CSE-IT guides, advocacy for youth, and that CSE-IT explained. I want to end with a study that was done by West Coast Children's Clinic. They are the organization that created and validated this tool. They said youth are facing increased chances of exploitation, recidivism, child welfare involvement, family separation, and dropout rates if they do not have adequate social support systems and resources. Many at-risk youth who are not yet trafficked are highly likely to become victims without early intervention, and data shows that 75% of trafficked youth are exploited for over 2 years before being identified. We are asking, this bill is asking, for that first step, identification for services to begin. Thank you.
Thank you. We can go through everyone and then see if people have questions at the end. Caroline Roberts, representing Children at Risk, and you are for the bill. Is that correct? Wonderful. You may proceed.
Good morning, Madam Chair Hull and members of the committee. Thank you so much for allowing us to testify on this bill. House Bill 451 would require that systems-involved youth be screened for human trafficking and exploitation. Thanks to your hard work, Texas has really led the way on anti-human trafficking policy. And this bill would build on that by preventing human trafficking before our most vulnerable children are victimized. In a U.S. Health and Human Services report, researchers estimated that up to half of child sex trafficking victims have been involved in the child welfare system. Systems-involved youth are vulnerable because of their history of trauma, instability, and a lack of support networks. Traffickers know this. They target and exploit those vulnerabilities. If we identify victims through investigations, that harm has already occurred. and with lifelong ramifications. It is time to prevent rather than react. Universal screening of the children we know are most vulnerable will allow us to prevent the harm before it occurs. It is both a more responsible and efficient use of our resources and prevents our children from being victimized in the first place. DFPS and TJJD, as Representative Thompson and my colleague have pointed out, have been using this tool since 2019. And it's already been implemented in these 5 largest counties. The children who are screened, the DFPS children that are screened, is those 10 years or older who are part of a sex trafficking investigation, 12 years or older with 5 or more placements, and then 10 years or older who have run away or gone missing. What this looks like in reality, and my other colleague will give you some of the numbers, is in 2022, less than 1% of the children in care. For TJJD, it was in that same year, 26,365 screenings, or about 58% of children in care. We already have the infrastructure to support these children. We know what to do for those that score a clear concern or a possible concern. We know that universal screening is cost-effective. This tool is a flat fee, so there's no additional cost for increasing the number of children screened. And it builds on Texas's leadership in human trafficking. By moving from reaction to prevention, we can keep our most vulnerable children from slipping through the cracks. They are depending on us to provide them that hope.
Thank you. John
Nehme.
there we go. You are with Allies Against Slavery, and you are for the bill. Is that correct?
That's correct.
Wonderful. You may proceed. Thanks.
Good morning, Madam Chairwoman, and thank you, honorable members of the Human Services Committee. I'm grateful for the opportunity to testify today in favor of HB451. As stated earlier, my name is John Nehme, and I'm the president and CEO of Allies Against Slavery, and we are a nonprofit organization with a mission to harness data to illuminate and eradicate human trafficking. In service of that mission, we built and maintain a software platform. It's called Lighthouse, that's used to help identify victims, track services, and show trends in data across the state of Texas. Since 2016, Lighthouse has facilitated the collection of commercial sexual exploitation identification tool, or the CSE-IT tool, as you've heard earlier. It's facilitated the collection of CSE-IT screenings from 261 different organizations that represents about 2,000 field professionals across the state of Texas. This includes those who are completing screenings directly in Lighthouse, as well as those who submit their screening data to allies outside of Lighthouse, which is then integrated into the platform. I want to build on what you've heard today already with some additional data from what we've examined and analyzed. As of October 2024, 174,243 screenings have been completed in Texas and collected in Lighthouse, of which nearly 10% scored a clear concern, which is that highest level of risk for sex trafficking and exploitation. These screenings are completed by a diverse group of multidisciplinary organizations across the state that serve vulnerable youth and young adults. Our Texas data shows a concerning gap. DFPS identified 371 suspected or confirmed victims of sex trafficking in 2022 through their investigations, yet only 332 children total were screened that year. As was mentioned earlier, this is only about 1% of the children in foster care for that year, and less than the total number of children that were found to be likely victims of trafficking by DFPS's own investigations. And here's why that matters so much. When we screen children, we begin to actually see what's occurred to them and can route them to the most appropriate services. Nearly 10% of all Texas screenings reveal clear concern for trafficking, but within DFPS specifically, this rises to about 37%, over 3 times the state average. And here's why. The data shows that system-involved youth are particularly vulnerable to exploitation and trafficking. In fact, the 2 strongest predictors of trafficking vulnerability in Texas are child welfare system involvement and risk-taking behaviors, which appear in over 1/3 of our clear concern screenings across the state. The following 5 indicators emerge as the most prevalent across those clear concern screenings: history of running away, child welfare involvement, sexual abuse history, juvenile justice involvement, and engagement in high-risk behaviors. 95% of clear concern screenings in Texas show at least one of those risk indicators. As my colleagues have stated, House Bill 451 would close a critical identification gap. Both the FPS and juvenile probation departments already have access to this validated screening tool, and the bill simply ensures that it's consistently used and applied for all youth in care. As one Texas social worker has told us, once you see it, you cannot unsee it. The ability to screen children puts into perspective just how many are at high risk and helps teams know exactly who to invest in and how to route them through services. Teams stand ready to support these victims, but we can only serve children who have first been identified. These vulnerable children cannot advocate for themselves, and they need us to ensure they're identified so they can receive the specialized care they desperately need. I ask for your favorable consideration of HB 451. Thank you.
Thank you. Members, are there any questions for